Good afternoon, everyone, and welcome to Utilizing PDSA Cycles in a School Setting. This webinar is part of our 2017 Student Wellness Webinar Series. My name is Kelly Unteet, and I'm the Communications Coordinator in the Office of Student Wellness. For those of you who are not familiar with the Office of Student Wellness, we are located at the New Hampshire Department of Education, and in addition to administering several grant programs, we strive to provide strong, evidence-based professional development opportunities to New Hampshire educators and those working with our state's children, youth, and families. For more information about our office, you can visit our website at www.nhstudentwellness.org. Some logistics for this afternoon's webinar. We encourage you to mute your telephone line or microphone to limit background noise. If you would like to voice your comment, please raise your hand in the participant box. We also encourage you to open your chat box, which you can find by hovering your mouse at the bottom of your screen. You can provide any questions, comments, or suggestions in the chat box, and our presenters will field them at the end of the presentation. A recording of this webinar and its slides will be emailed to you within the next week, and they'll be posted on our website and YouTube channel. I'll also share the link in the chat box for you to access at the end of the presentation. I want to take a moment to mention that the Office of Student Wellness will be hosting a multi-day in-person follow-up training to this webinar in June, and we will likely have some limited seats available for that training. You will have an opportunity to register in the coming days for whatever slots are available. So without further ado, I would like to introduce you to today's speakers, Drs. Elizabeth Connors and Nancy Lever of the Center for School Mental Health at the University of Maryland.
Thank you, Kelly. I'm Nancy Lever. I am the co-director of the Center for School Mental Health, and I've been fortunate to have the opportunity to work with New Hampshire as part of the Safe Schools Healthy Student Initiative. And Elizabeth Connors, I'll let her introduce herself.
Thanks, Nancy. Hi, everyone. My name is Elizabeth Connors. I'm an assistant professor here at the University of Maryland and on the faculty with the Center for School Mental Health. And I also work with Safe Schools Healthy Students, and I'm a resource specialist for the National Resource Center on Mental Health Promotion and Youth Violence Prevention, and happen to have been trained by the Institute for Healthcare Improvement as an improvement advisor. And so the PDSA cycles that you'll be hearing about today have been part of our recent work with New Hampshire here at the center, as well as some national work that we've been doing in our learning collaboratives with school mental health districts across the country.
So we're very excited to be here today, and we are hoping to get you excited about change and to think about what is possible within schools at an individual school level as well as the district level. In terms of what we'll be covering today, we're going to review what is meant by a PDSA. So we'll talk about what they are and why they're valuable to schools, how they're really part of the change process. And it's a tool that often people they think they may know how to use it, but there really is a whole science to using this, and we hope to get you incredibly excited by the end of today's session. And we'll be talking to you and having some opportunities to discuss how you can execute a really strong PDSA, and that you can really use that data to check to see whether you're actually making improvements within the school. And we're excited that we're able to share some outstanding New Hampshire examples related to mental health in schools. So we know that there are many things within schools and school districts that need to change. You know, often whether it's around a child's education, their mental health, that there are ideas that people have and things that you can identify either individually or as part of a group, and people will say, we need to make a change. And one of the things that we want to make sure happens is that we don't just continue to admire the problem, where we all sit around and kind of wait to see, what if we don't change at all and something magical just happens? Now, that would be absolutely fantastic if we could sit around and that magic would happen and all these great changes would occur, but waiting for something to happen and hoping. Hoping is not a strategy. It's something we all do, but figuring out how do we affect change and how do we do it in a more methodical way. And we all been in the situation where, do you ever feel like you're attending a meeting where the purpose of the meeting is to schedule another meeting? So as you see the person talking, we need to schedule a series of meetings to discuss whether we should have a meeting, to look at whether we're having too many meetings. Meetings are an important aspect of the work that we do and affecting change, but part of it isn't the meeting itself, it's what's occurring in that meeting. So part of what we'll be talking about with PDSAs is thinking about how do you effectively use meetings. It's not about the length of time, but making sure when you have a meeting that they're productive and effective, because everyone's very busy with multiple demands, and we want to make sure that everyone's able to, if you're going to be pulling someone for a meeting, that something is being accomplished that's worth that amount of time. One challenge that we all often run into is, we can have someone coming to offer advice and we're so busy. We're so busy putting out fires that we may miss some really clear direction that is right in front of us. Having our square wheels, when someone's holding those round wheels and ready to help, we want to make sure that we're listening and valuing all that information around us. I think often not hearing that lovely man in the glasses is not intentional. It is just that people are so busy and trying to get something checked off that they may miss something that is right in front of them. And I think sometimes anyone feel this way when they came into work today, that we're taking on too much. We have a lot of baggage. We're, trying to take the world on. And, one thing we know, it's very rare that one person can affect change. It really does take a team working together, but in terms of what you take on, you want to be careful that you're not taking on too much and that you're not overwhelming the system and yourself in the process. This poor guy, it looks like he's still moving, but he really is struggling. And, perhaps if he just took one of those batches, that would have been a better system. And here's, when we're trying to fly the plane that hasn't quite been fully built yet, when we're hoping for large-scale change and we haven't tested it, if you're going to put the effort in, you want to make sure you're testing it at the right moment. If you test too soon, you may miss out on seeing that you actually have built something. It's just you needed to take it a little bit further. So, there's a lot of things that can go wrong when we're trying to test for change. And one thing would be if you're testing too soon. So don't throw out the whole product when potentially you have a good idea. It just needs to be built out a little bit more.
Yeah, and so to follow up on this and to clarify, I really think where we get into trouble is when we're really implementing too soon. And I think that there are a lot of very well-intentioned reasons for wanting to get that plane up in the air, and whether that's launching a new evidence-based practice across an entire district or changing an entire multi-tiered system of support or RTI process even in one school, there is a true need there of our students that needs to be met. And so there are a lot of legitimate pressures for getting the plane up in the air, even if all the pieces haven't been built and tested. But just think about the risk that you potentially put yourself in when you're up in the air in a plane that doesn't have a roof. And so I think, this is probably our biggest message for today is how can you test things on a small scale before launching an implementation, so that once you do that, you're doing it from a really stable place of growth, and that you've really built a lot of confidence and will that it's going to go as intended.
Okay, so let's think about a scale of change. And I think sometimes people, if you look at this, there can be a continuum where we're talking about change as it relates to one child to on the other side, on the right-hand side, you could be thinking about a larger system, so like an entire district. One thing to consider when thinking about this is there's a lot of room in between these two extremes. So you can test on one child a change, but there's a lot between testing for that one child and making a plan for an entire system. And, you know, to affect change and to think about that larger school system, an entire district, that can be overwhelming. You know, so one of the things that we recommend is, you know, to think small. And I think that can be kind of freeing. It is okay to start with one child and or maybe it's a few children, maybe it's one classroom. So as you're thinking about what can we do to improve the system, one of the things that we encourage as part of this improvement effort is to really start small, do small tests of change, and to think about what is it that you're learning. So it's an iterative process that you can keep improving things over time before you get to that larger scale test, which may be more expensive and more challenging to implement.
Okay, so we really now want to dive into this idea of what a PDSA or a Plan, Do, Study, Act cycle is, and really talk about the power of starting small, as Nancy was saying, so that you might be starting with one student, one family, and slowly kind of going up the rungs of the ladder, so to speak, to all of those steps, so that you're starting to achieve your improvement goals in your school in a really stable process that is going to kind of minimize your large-scale risk. So first of all, what is a PDSA? Sometimes when we've talked to new groups about PDSAs, I'd say some people have heard of this before and some haven't, but it's basically shorthand for testing a change by developing a plan to test a change, that's the plan part, carrying out the test, and again, this is a very small scale, informal, not complex kind of a test. We're thinking about the left-hand side of that continuum Nancy just showed you. Observing and learning from the consequences. So sometimes I like to say study is all in lower caps. This is not a research project. This is not a whole program evaluation. We're talking about a small look at what happened, and then determining what modifications should be made to do next. So what are you going to do to adapt next? And there's a lot more resources you can find on PDSAs and change planning at IHI.org. That's the Institute for Healthcare Improvement.
Now, I know when I first learned about PDSA cycles, I thought I was doing great, but I think I thought of it as a PDSA cycle. And I don't think I really understood that this is really a process and something that you continue to do. You do multiple PDSAs. And I think often people think of, okay, you go through something, you run through it once, and now you have the answer.
Exactly. So what we'd like to see, and I'll show you some slides later that actually show this in a visual way, that you would string together a number of small tests and then scale up to medium-sized tests and then large tests, so that you're kind of doing this rapid cycle testing back to back. And just to kind of let you know, a PDSA, we're talking about something that could be completed in 3 days, 3 school days, very short. A couple of times I've been to conferences and they talk about a year-long PDSA, and I was very confused by that. This should be a short, small, as Nancy would say, cute little test of change that you can learn from in a quick way. I think the other pitfall is that many of us in schools are doing PDSAs all the time, sometimes without the plan part. I think really sitting down as a team and planning what you expect to see up front can make a big difference in terms of the potential impact of these things. So again, just to recap, to be considered a PDSA cycle and starting to go a little deeper into each of these, first you want to plan a test or an observation, and you want to make sure you include a prediction about how the change will result in an improvement. So think about this, go back to what you've learned about the scientific method and think about it on a really small scale. You want to predict what change this would have and how that would result in an improvement. And you want to include a plan for actually running the test and collecting a little data to study it. You have to definitely attempt the plan, so don't forget to do the plan. And then you set aside a little bit of time to analyze the data and study the results. So you see, did my prediction hold? What assumptions might need some revision? And then finally, the action is based on what was learned. So the first one here is adapt. And I would say for the vast majority of your PDSA cycles, you're going to keep in the adaptation phase for a while. You might decide to adopt it. So after you've run a bunch of tests and you're ready to launch your plane in the air, you might adopt it for large-scale implementation. Or it might be a total bust, and that's okay, and that's important learning. And that would be where you would select abandon.
And I think that's something many people who've done well in school, who are professionals, it's hard for us to let go of ideas. But sometimes we can spend more time trying to make something work, where probably the better action would be to let something go and to start anew. But it's kind of freeing to know that that's an option.
And that you tested it out before you abandoned it. And it was based on something that was planned and that you did and you observed it and you decided as a team, as opposed to maybe, you know, a gut impression on what maybe would work or what wouldn't work. So there is in the web page that Kelly put together for this webinar, there is an example of the PDSA worksheet, and it's actually a Word document version, so it should be fillable. But this is a way that you could actually document a PDSA in one page. And the teams who we work with, including 3 of the teams in New Hampshire, this is how they actually document their PDSA. And I would say that you don't have to use this form. This is certainly the conventional form to use, but you want to be documenting this somewhere. You wouldn't want to be doing PDSAs without keeping track of it. And this gives you a little bit of a track record. So we'll come back to the sections of this form, but as you can see, it includes those general plan, do, study, and act sections that we just reviewed. Okay, so back to the big picture for a moment here. If we haven't quite convinced you yet, this is just a little 2x2 table that shows that, you know, you could have a size of a test that's small or large, but you could also have consequences of a failed test that are minor or major. And so typically, if the size of your test is small, even if the consequences are pretty major, you still haven't lost much ground because you haven't made a huge impact yet on your system. If the size of your test is large and the consequence is minor, maybe that's not such a big deal if it fails. But guess what? If the size of your test is large and the consequence is major, then that's when you start getting into a disaster zone. And we talk about what a big risk, and I think we've all experienced this when implementation has happened too early, the test was too large, it wasn't ready to be, you know, brought in on that scale, and the consequence was pretty big when it didn't work out. And by consequence, I mean things like staff fatigue in schools. You know, there's such a thing as intervention fatigue, or students or parents, you know, not responding favorably to what happened because it was a big flop. And I think that you can probably think of other examples that maybe you've experienced in your professional career. So there's a number of reasons to test changes before we go to implementation. First, we really want to think small, and it forces us to do this on the PDSAs. Even in your documentation of the PDSA, if you start going to page 2, probably your test is a little too large. We want to stay within what's going to be practical and manageable. Again, especially talking about schools and student wellness. This is a busy context. Everyone has lots of things to do, lots of meetings to attend, and a lot of student needs to attend to. So we really, if we're going to start affecting change, it must be small, practical, and manageable. Also, we want to make sure we're predicting how much improvement could even be expected from this change, and then confirm or abandon your predictions. So we want to be forward thinking. We don't want to be reactive or putting out fires if we can avoid it. Testing changes allows us the opportunity to learn without impacting a lot of performance. It keeps us in the low risk zone for change. And that gives us an opportunity to learn how to adapt it to the conditions in the local environment. There's a lot of local conditions that really will determine whether your change is going to be successful or not. So even if you've borrowed a great idea from a neighboring district or school or something a parent has recommended, until you test it out in your waters, it's not going to be clear exactly how it's going to work. So if you're testing it small, you can adapt a little bit.
And what's exciting about this process and strategy is really you can personalize it to your own needs. While the larger structures would stay the same, you have a lot of options about what you can do so that it fits, your school, your community, and it isn't cookie cutter.
Exactly, exactly. And so the other thing that is very, very useful in the healthcare setting where this really derived from, and really in the school setting as well, is that there might be resistance to implementation. Change can be hard. The power of the status quo is large. And when you start by testing things on a small scale, you can start testing with your champions, and you can build some will as you build some confidence that your change is actually going to work and it's going to lead to improvement. So as you're scaling it up slowly, you're minimizing your resistance to that implementation, and ultimately it will be more successful. Again, we touched on localing a good idea to your school or community setting and adapting changes before implementing. Certainly increasing your belief that the change will result in improvement is very important, and we'll talk a little bit later about how not all changes are improvements. And then finally, it does provide you as a school or district team a history for how you came to your end result. It's so great seeing our learning collaborative teams who now have a number of documented PDSAs where they can look back and say, sounds like something we did before. What did we learn in that PDSA? And they can kind of flip back and say, oh, that's right, it didn't go as planned. This is what we learned. So you kind of save yourself from losing some ground. And especially for teams, if you experience some staff turnover or other, disruptions in the school calendar, this can be really helpful. So a few key ingredients for success to keep in mind is having an idea for improvement. So I like to say that no one can really give you a change idea externally. Often these are generated within teams. However, we very much encourage you to borrow from other teams, and that's why we're going to share some examples with you. But you need to have an idea for improvement. You're going to start small, and then power, passion, and work for the work in numbers. So none of this is supposed to be done with one person on their bicycle. This is really a team effort and a team sport. And to be done successfully, you definitely would want to involve 2 or more people at the very least. Okay, so how do we test something huge though? Because many times the questions and ideas we have for change are kind of big ideas. And so this old Chinese proverb reminds us that it's better to take many small steps in the right direction than to make a great leap forward only to stumble backward. So this is a long history of wisdom here to this logic. And what you really want to do, and for those of you on the line who might be mental health providers, you might be familiar with this SMART aim, or those of you who work with IEP goals are probably familiar with this SMART aim, but you want to have specific, measurable, actionable, realistic, and time-bound goals. What are you trying to accomplish? Be clear on why it's an important goal and have some shared agreement about that. And decide on your time frame, because it might take a little while longer to reach that larger goal, but these small steps in between, if you run them sequentially, actually can go pretty quickly. You want to make sure you're breaking that large goal into small pieces to accomplish one by one. So this is kind of general goal setting guidance, but works very well when you're planning out PDSAs. This shows the steps to change, and here you can see what I was talking about and Nancy had referenced to, where you have more than one PDSA cycle. You kind of string them together like a pearl necklace. So you can see those 4 circles there that are going upward, and they have PDSA on the inside of them. And so in your beginning PDSA, you might be developing a change. You have a change idea. You might not have a lot of confidence yet, and you're working on the prerequisites for that change. And as it becomes a little bit more stable, you might have a prototype to that change, a way that it might work across different classrooms, across different schools. And then when you have a prototype, you can test it under a variety of conditions. The reason we test under a lot of conditions is to identify weaknesses or gaps. A great example of this is a specific team meeting process. Maybe there's a 504 team or a tier 2 team that you want to start to develop a prototype for how to run that most efficiently, but it might not be working consistently across all your buildings or all your teams. So you want to test it across a variety of conditions to identify those weaknesses. So you can kind of work out all the kinks before you go to implementation on the 3rd PDSA circle there, and you can start embedding it in those daily operations, and hopefully you can get it to the point where there might be some system, district, or state changes resulting in improvement. So you can see here, this is not just one PDSA cycle, but it's multiple tests kind of strung together. And so looking back at that PDSA worksheet, if that's something that you're interested in using or potentially using, I want to call your attention to the top box here. So it asks for your team name, when the test is started and finished, and the part that's circled in red is what change idea does this test? And I will tell you that although it might sound kind of logical, this can be a challenging part, because sometimes we haven't thought through the full change idea or the improvement, but we have an idea of something small that we might be able to affect change. So let me give you an example of what a change idea might look like. So a change idea is where you make a change to your day-to-day activities, practices, or processes that are predicted to directly or indirectly result in improvement. So here's some examples from IHI. And you'll see they're a little bit healthcare oriented, but I think that they work well. And I'll show you on the next slide some school-specific change ideas. But think about eliminating duplication, creating efficiency, improving workflow, optimizing service delivery, changing the environment, managing time better, reducing variation. This is a big one, tends to be in school mental health systems, improving consistency, error-proofing something, so if it's working well in some pockets, but still has some kinks, and improving a product or service. So I'm sure you're already thinking of all the parallels to schools, but I wanted to share a few that have come from the districts that we work with in our collaborative improvement and innovation network, which is just a fancy word for a learning collaborative. And we've had 2 cohorts do this with us now. We've got 25 teams we're working with across the country using this process. And actually 3 of those are New Hampshire teams. So New Hampshire is definitely becoming a champion in this area.
And we know from our first cohort of teams, some of them came in a little skeptical, like, how is this process? How will it help us change when we think we've done this, we think we've tried this, but using the PDSAs, really keeping track of your data and having the coaching and support around this has really made a difference. And also, I think, saved a lot of time and money for not moving forward with ideas that probably weren't ready to move forward.
Absolutely. And also just building team consensus, because I think sometimes we might try out changes that we think will work, but we may not have everyone at the table in full agreement that that's the direction we want to go, or sometimes we need to actually test some change to build that will. So I do think it's, it kind of sounds like going slow to go fast, if you've heard that expression, but it really does help kind of teams move forward, especially those who have felt like they've been kind of stuck for a little bit. So here's some examples just to get you thinking about what this might look like for student wellness. The first example is school support staff from different schools to start meeting together quarterly to drive some more systematic response to intervention processes. So this would be a change in the way they're meeting, and this would be bringing together a different composition of stakeholders, and what the prediction is that it will actually improve a systematic RTI process. So all these change ideas, you'll see there's one part is the change, and the other part is what it's going to improve. The second example is adding feedback loops to school staff following student mental health screening. And in this example, they actually left out what the improvement is. So the improvement would be something like, you know, improved detection of mental health concerns. And for this team, it was actually about having more better data collection. So they were finding that it was really hard to get their screening data completed because it was teacher self-report. And as you know, teachers have so many things to do in their day. But what they said was, you know, if we can do a little bit more feedback to our teachers, maybe they would understand how we use this information, and we might see more, our completion rates go up. And in fact, they've done a number of PDSAs around that and are seeing just that. The third here, I believe, is from DC Public Schools. They're working to optimize mental health provider time in buildings. And I love that they've included a specific target. So they want to ensure 15% or less of their time is spent on non-mental health related tasks and increase appropriate services provided to students. So here they're looking at optimizing the amount of time spent and what activities are providers really allocating their time to.
And that's a goal that could fit across many mental health programs where it's very easy for providers to get caught up in other non-clinical related activities. So those are, you know, as you're working on PDSAs, you may have your own individual goal, but if you do this as part of a collaborative, there's a lot of opportunities to learn from other sites.
And thanks, Kelly, for putting the resources in the chat box. This is one, Kelly, I can send to you to add on this page. I didn't send it because this might be a little bit ahead of where people are right now, and we'll definitely be going a little bit deeper into some of these planning tools in the 2-day training that Kelly mentioned. But it can be helpful to actually have a strategic action planning process where you outline your change ideas, concretely say how it will result in improvement, and then kind of build your PDSA ideas from there. So this is, you know, thinking ahead a little bit. The goal of today's webinar is really just to get you familiar with what a PDSA is, but we wouldn't be doing the PDSA justice if we didn't talk about the fact that they are tied to specific change ideas. And we want you to be really mindful about what the bigger picture change idea is and how it's going to result in improvement to student wellness specifically. So this may go without saying, but I think is still important to point out. I think Nancy found this wonderful image for us, which describes that not all changes are meaningful. And I think we've probably all experienced this in one way or another. The cartoon here says, when we talked about radical change, I expected more than a new font on the company letterhead. And who knows how many meetings maybe went on for that to happen. So again, sometimes we see teams, for example, there can be pitfalls getting stuck in maybe visioning processes or formatting of forms, and it's not really the scope of meaningful change that needs to happen. So just keep an eye out for those pitfalls and make sure if you're using PDSAs, it kind of helps you protect against that. Sorry for the slide delay here. The other thing to keep in mind is that not all changes are improvements, right? So we've got our furry little friend here. He's gotten all cleaned at the groomer and the comfort of his own home. But man, that hairstyle doesn't look quite as good. He's still pretty cute, though, I have to say, for the after pic. But, you know, all improvement requires change, but not all changes result in improvement. And, you know, I think sometimes another good example is new technology that might be introduced into our workflow, and how hard is it to introduce a new email system or EHR or student tracking system. And you might get used to it over time, but in the beginning you're thinking, this is not making my work go faster. This is bogging me down. So there are many, many changes in our workflow. Not all of them are improvement. So I think we can probably all think of examples of that. The other thing to really keep in mind, we touched on this with the concept of abandoning a change idea, is that not all failures mean your change is doomed forever. And these are just examples of important failures early on of extremely successful people who kept at it, and guess what? Those failures have become very famous. Another one I like to use is that, I don't know if you guys are familiar with the Angry Birds game. I think they went through something like 52 iterations of that title and that game before they settled on the, you know, the groundbreaking $1 million making one. So keeping in mind that all learning is important learning, and even if your PDSA did not work out the way that you planned, that failure is very important, and in fact, I would argue is definitely a success. So this just repeats a little bit of what I had said before, but I think that the visual is a good one, that you're moving from hunches, theories, little change ideas, all the way up to bigger changes that result in improvement. So you're going to be doing these PDSA cycles kind of over and over on a pretty small scale to follow up and test conditions, wide scale tests of change, and then finally implementation. And we were just on a call earlier today with a team that's done this, and they were sharing their PDSA cycle number 8 in universal mental health screening, because they had 7 before that they were still working out the kinks. So have as many PDSA cycles in this whole strand as you need to. And again, as you're learning, you're building confidence, and your team is becoming more on the same page. It can be very energizing and motivating to be making these gradual improvements that really do start building on one another. And then you look back in the past 6 months, if you're running a lot of small scale tests, they really do add up. Okay, so just a brief note on this is that I think we all live in a task-heavy environment, but tasks are not tests of change. Both are necessary, but they are not the same. And a test is putting a change into effect on a temporary basis and learning about its impact. So you actually have to change something on a small scale and study it. What is not a test is collecting data, implementing a solution, a project plan or action plan, rolling out an educational program, scheduling a meeting, getting a form, policy, or procedure approved by the official committees. Now, I could argue that there are tests that you can build in for a variety of these, if it's actually an intentional change to your day-to-day activities and you're collecting data and you're studying it. So you can creatively turn some of these into tests, because often our task list is long. But I think as Willy Wonka reminds us here, and as Nancy touched on, we don't want yesterday's meeting just to be scheduling another meeting on Thursday. We really need to start making some changes in the status quo. And this just kind of, again, distinguishes the test from the task. And the reason why a task is not going to help you move forward as much is because although it's that vital behavior that has to happen for an action to take place, and it should be identifiable and defined and supported by evidence, it doesn't let you predict improvement. It doesn't provide that quick feedback as a test does. A task isn't really trying something new or making changes, and it can't really help you identify changes to be made. So really want to make sure that we're truly testing things to move forward. The best example that I have for this is that if your desired change is eating a healthier diet, your task is to go to the grocery store and get the right ingredients. But the test is whether you actually eat those ingredients and put them in your body.
Mm-hmm. Having it in your home does not count.
Having it in your home does not count and is not going to encourage you to eat more apples and chips. Mm-hmm. Okay, so here's some quick tips. We'd like you to think about how you could plan multiple cycles for a test of change and thinking ahead. Usually when teams start doing this, we encourage them to scale down smaller and smaller and smaller. It's probably smaller than you even quite realize. You want to test with willing volunteers, with your champions. Don't try to get that buy-in or consensus first. To be innovative, you've got to work with people that are willing to start soon. And collect useful data during each test so that later you can test it over a range of conditions. There's a great example from October Sky if you haven't seen that. Oh, sorry, I think it's going backwards instead of forward. Okay, so I'm going to pass it over to Nancy, who's actually going to talk with us a little bit about some New Hampshire examples to give you some concrete ideas of what PDSAs might look like. I do want to acknowledge the 3 New Hampshire teams that have all willingly said that we're give us permission to share their improvement work with you all, and they're really been champions of this process, and so we hope we're good stewards of their improvement information.
And those 3 sites that have been part of our collaborative include SAU 7, Newport, and Pelham. Mm-hmm. And they really, have been pioneers in this work, and as we bring some of these efforts to New Hampshire and through the Office of Student Wellness, there really has been some tremendous leadership to help move this school mental health and multi-tiered systems of support forward. I think, any of those 3 teams will be in an excellent position to help move the work forward. Mm-hmm. So let's look at this example from SAU 7. One of the things that they did is they developed a Tier 2 meeting process for utilizing best practices for meetings. So one of the things that they were concerned about is they didn't think that the process they had, that they were really using some of those best practices. So what they were doing when they looked at best practices to be used for meetings, they then studied this over the course of time to see, and again, this isn't over the full year, this was over the course of a week, to see the impact of, if they use these practices, how did that impact their ability to accomplish things as part of the meeting. So they were willing to test that, so they decided on, in terms of some of the tasks that they did, they decided on a team lead for each team. They developed very clear meeting agendas, developed missions and norms for the meeting. They held the meeting, and then they really had they looked to see the impact that they had. And what they found is, they found that the meetings tended to be very rushed towards the end, with less time for students who were discussed later on, and they weren't able to, review those plans and get into as much of a discussion. So by doing this process, it helped them realize where their shortcomings were, so that they could then adapt and figure out how to have a timekeeper for each of the meetings to make sure that each student was presented and had a similar amount of time to address their concerns. So, basically being willing to look at a meeting, and, we've all been part of meetings that aren't run well. We all have probably run meetings that aren't done very well, but being able to look at that and consider what you can do to improve. Another example, also from SAU 7, is they were creating a Tier 2 training program that could lead to better and more effective Tier 2 implementation and increase positive student outcomes. So what they were trying to do was essentially to develop the training program and review and adjust the training program as needed based on, once they had delivered the training program, to see did they actually accomplish what they were hoping they would. In terms of what they accomplished, let's see,
in this one, they were curious about the different objectives, because I believe they had a lot of objectives to cover in this training, and so they really needed to they collected a little data afterward to see which objectives were well covered and which weren't, and it looks like they learned that participants really needed more training on specific interventions and matching needs, and so actually in their next adaptation, they're going to add a separate training to specifically meet those needs. So here, kind of going beyond maybe your boilerplate satisfaction survey that you might do for a training, but really thinking ahead, how could we optimize this opportunity to see how the training is going and follow up appropriately.
And again, it took some bravery instead of just admiring the great product. The training sounded like it was well responded to, but they were willing to put it out there to say what's missing and then to fill in those gaps instead of waiting years to see, what they didn't have.
Mm-hmm. And then the last one that we have here, let me see if it'll advance, is from Pelham.
Okay, and what they were really looking was how to assess the data collection tool that they were using, and they were looking between using the SWIFT system versus the current system, the SIRP system. And what was interesting with this, and can be quite helpful and save them a lot of time, is as they got into doing this work, they discovered that there are 2 teams that are working on the same purpose, and some even had overlapping members. So, the challenge becomes how do they, by taking the time to slow down and look at this, they realized that essentially there were multiple people doing, in their district who were looking at the same thing, but they weren't necessarily working together. So they didn't abandon this, but they needed to get a lot more information to figure out what is it that their role is and how do they make sure they have the right people working together on this so that as a district they can come to a conclusion.
I think the really interesting thing to note about this, and it's very indicative of PDSA, is you see when we're talking about this study part of this PDSA is that it's small, and study might be just collecting a little bit of data, which could even be feedback from frontline people who are working with students, who are in meetings. And oftentimes we see that teams, by kind of slowing down this process and planning it out and, actually talking to people, that there's aspects of what they're looking into that they could never have sort of seen ahead. We say hindsight is 20/20, right? And so that's what we want to protect against with PDSAs to the best of our ability, is just, can we improve that foresight, and can we ask all the relevant questions at a small scale, work out those kinks, so that, as Nancy was saying, there's not a big investment lost. Or for this, I mean, imagine if they just said, we've heard about SWIFT, it's really exciting, and administration is on board, and we're just going to start this new data system without doing this background testing that they have. Could be a big disaster potentially, or a duplication of what else is going on in the state or the district. So they're learning a lot here, even though it wasn't what they predicted. It was very useful for them.
And that's a pretty common lesson. Often it isn't what they predicted, but it ends up being very helpful and can ultimately save a lot of money and time by not, wasting too much time going in the wrong direction. So in terms of some of our next steps for PDSA trainings, and we're saying PDSA trainings, but it's really much broader than that. It really is around quality improvement and affecting change across, whether it's a multi-tiered system of support or school mental health systems. That's really what we've been working with the Office of Student Wellness. We are going to have a leadership meeting with some of their leadership and our Center for School Mental Health in May to discuss, how to integrate this training into the larger quality improvement efforts in New Hampshire. And as part of that meeting, we will be discussing the June 28th and 29th training, which is really an opportunity to go deeper into quality improvement and change, to learn more about PDSAs, but also the larger change process. Elizabeth really likes her school bus.
I love this school bus, Miss Frizzle. She's the best.
And I love the message from Miss Frizzle, which is take chances, make mistakes, and get messy. And I think being willing to make mistakes and to not have the best opportunities, it's okay to, when you're thinking small, to put yourself out there. It's not as dangerous to make a mistake than if you put all your eggs in one basket, spend a fortune to then find out there were some mistakes you made along the way. So it really offers a lot of opportunities. Now, I know we have some questions that have been sent to us along the way, but I also want to invite people to type into the chat box if you have additional questions. So why don't we respond to the questions that have been coming our way. Let's see, who should be part of a PDSA process?
Yeah, so this is definitely any key stakeholders that would be relevant to your change idea. So think about your kind of ultimate scope and scale and make sure that you have, appropriate representation. So this can be teachers, students, parents, administrators, providers, anyone who would be potentially affected by the change process. Now, that being said, you don't have to have an exhaustive big team. And in fact, when you're starting small with change, it can be a smaller group of folks who are trying out something new. Once you go to your medium size and then large size PDSAs, you'll definitely want more people involved.
Okay. Is there a cost to using PDSAs?
No, that's one of the best things about PDSAs, is that it fits everyone's budget. There definitely are some folks in New Hampshire, fortunately, who have been trained on the Institute for Healthcare Improvement, and including Mary Steady and some colleagues with the Office of Student Wellness, and Kelly Unteet, who's on the line right now with us. So I would say, relative to other states that I know of, New Hampshire has a lot of training and support around using this improvement process with PDSAs. So, there's not a cost to the PDSAs, but it is helpful to have someone to kind of provide feedback and guide you through the process. And so I would say there is a little bit of technical assistance that's helpful as you're getting started.
Right. But then on the other hand, you can also argue that there is a cost to not using PDSAs if you haven't taken the time to really think about what's needed, or you're doing a test before it's ready. There could be a waste of money and resources.
Yep. Oh, and then the other one that we did see, there's a couple. So one is, how can we take a risk very small with limited resources? And that's a good question. But, really, if your risk is small and your resources are small, then I would say get less at the grocery store, right? So we talked about the tasks that are needed to build up to a PDSA. And I think that's the biggest pitfall of people's tests being too large, is they've got to do all this pre-work and all this tasking before the test can be run. So if that's happening, you want to shorten what you're getting at the grocery store and run that test sooner, because then you're maximizing those limited resources.
Right. Okay. Another question: can a PDSA be used to help or inform clinical treatment?
Yeah, absolutely. And in fact, that I would say primarily PDSAs were developed specifically to inform clinical treatment in large healthcare institutions and hospitals and medical centers where the risk of change was actually very high. PDSAs in the improvement process have been used in surgical centers to prevent unintended death, and have been used actually in very high risk medical and chronic health condition type of context, and really starting small with understanding different surgical instruments to use. And so if you think about some of the risk perhaps relative to school mental health, the PDSA process and the improvement process comes from a pretty high risk healthcare environment sort of context. So clinical treatment is what they're designed for, with the idea that if you're starting small, then if there were an unintended consequence, then you would be able to control that risk with a small sample size of 1 or 5 students at a time.
Okay, well, thank you for those questions. We hope we've helped to clarify. Any additional questions? Okay, well,
it sounds like we don't have any further questions, so I want to take an opportunity to thank you, both Nancy and Elizabeth, for sitting with us this afternoon and sharing this really great information. I certainly learned a lot, and I hope everybody else did as well. I encourage anyone on the line who is interested and in looking at some ways that they might be able to use this approach to join us for next month's webinar on choosing and implementing a comprehensive social emotional learning curricula And Dr. Megan O'Malley will join us and give us some thoughts about ways we could use PDSA cycles in that arena.
Thank you so much, everyone.
Yeah, thank you. Have a good afternoon.
You too. Bye-bye. Thank you.
Not sure.
Isn't that like limitation only? They open up as a general, like, those are only people that are like involved.
If she registered for any of, like, if she registered for their mailing list, she would be on there. So, I don't know. So let's schedule our next meeting. And I know, like, Sandy had some questions about, like, our pyramid, triangle, tiers and definitions, that I want to make sure that we cover next time, because I think they're really good questions, and they're things that we have to think about from a district level with where we're going. So when do we want to meet next?
You send an invite?
Yes, I will send an email, please.